Hi everyone, and welcome to November's session of Healthy Dynamics. I really apologize that Dr. Hirth was not able to join us this month for a COVID-19 update. His schedule is really busy right now, and we just haven't had time to set aside for filming. So we will bring that to you in a couple of months, and Dr. Hirth will be with us at that time. But I did want to get with you today to answer some questions that residents have brought to me pretty frequently about some COVID-related issues and things going on here at Still Hopes. And then also to bring to you some information about the annual enrollment program, which is going on right now for Medicare. And so we will have with us Wes Lane, who is with Senior Resource Services, to answer some of those questions for us. So thank you so much for being here and for joining us today. Wes, thanks for joining us this afternoon. So glad you're here. Have just a few questions for you. Our residents have been asking a lot about the enrollment period, what to do about insurance for next year. So just want to give them a little guidance with your experience as a basis for that. So please tell us just a little bit about your background and your experience with insurance and insurance issues.
So I am a certified Medicare specialist. I'm also certified in long-term care. And I'm a licensed insurance broker in the state of South Carolina. So I pretty much represent every major company in South Carolina that can cover you and offer you this type of protection. I've been doing this for many years now, and I operate here out of Columbia.
Could you tell us just in a nutshell the definition of AEP, the annual enrollment period?
Sure. So AEP stands for annual election period. And basically that occurs every year between October 15th and December 7th. And that's an opportunity for people with Medicare Advantage plans to review what new plans are coming to their area for the following year and to decide if they want to stay where they are or maybe switch to a different plan. It's also the time where people who have standalone drug plans can review their current prescription coverage and make sure there's nothing cheaper out there for them, or maybe their plan dropped one of the drugs they were taking. They'll be able to switch to a new plan. And quite frankly, it's a great time for people with Medicare supplements to review their coverage because the government mandates how those plans work. And in a lot of cases, you can save quite a bit of money on your supplement premium every month by having that plan reviewed and switching to a lower cost one.
And outside of this annual enrollment period and the time frame, can individuals make changes to their insurance plans for the next year?
You can. There are very specific times you can make changes. People who are low income or on low income subsidies have what's called special election periods where they can switch. If you're brand new to a Medicare Advantage plan this year, let's say you enroll for one this fall and it starts on January 1st. If in January you decide it's not what you like or not what you thought it would be, January 1st through February 15th is what's called open disenrollment. And that's where people who are on Medicare Advantage for the very first time can actually opt out of that Advantage plan and go back to regular Medicare. So yes, there are a few times during the year where you are able to switch other than the annual election period.
So we have residents who have a lot of people calling them and getting a lot of advertisements in the mail for take this plan, do this plan. Who are these people that are calling?
So these people that are calling you work for many different companies across the country. And the reason they're calling you is because it's AEP. How do they get your name and number? Very simple. They buy these phone lists. They buy them from third-party vendors who sell public information, and they basically just buy them in bulk of people who are over 65 years old. And it can be very predatory because they don't know what kind of coverage you have. They're simply trying to talk to you about Medicare in general, and sometimes it can be very confusing, and they use some trickery. And if you give out too much information or you stay on the phone with them too long, they can sometimes even switch you without you knowing. So, a good rule of thumb, I think, when it comes to your health care and your retirement is to not do business with anybody who's not willing to come meet with you face to face and explain everything to you and show it to you in writing. Handing out sensitive information like that over the phone and making changes over the phone can be very dangerous.
There's a lot of confusion about Medicare Advantage plans versus regular Medicare with a supplement. So describe for us a little bit about the Medicare Advantage plans. They seem to be no or low cost on the front end, seem to beat, if you will, the Medicare supplements that way, but why? What's the catch? You know, when you look at that, if it seems too good to be true, it probably is. Help us figure that out.
So, original Medicare with a Medicare supplement, you pay a monthly premium. But then in most cases, if you choose the right plan, you don't have any doctor or hospital bills again for the rest of your life. You simply pay that monthly premium. There's no surprise cost anywhere. So what do you trade for the monthly premium? Well, that's where Medicare Advantage comes in. And it's not for everybody, but understandably, it's there for people who need it. But Medicare Advantage has a very low premium, like you mentioned, in some cases even a zero premium. And that's because it has a lot of disadvantages, as I like to call them. First of all, your care is restricted to a network. So you have to stay within network. If you go outside that network for any reason, you can pay higher out-of-pocket costs. Secondly, you'll always be looking at co-payments and deductibles. That's going to be part of the plan forever. You'll always have to pay those. And thirdly, depending on what happens or what situation you find yourself in, most Medicare Advantage plans carry either a $5,900 to $6,700 annual maximum out-of-pocket. Now that's a lot of money. So if you end up hospitalized for several weeks or something really serious happens, a car accident, a fall, a heart attack, a stroke, and you find yourself with surgery, rehab, hospital stays, you can very easily end up hitting your maximum out of pocket, and $6,700 is a pretty big surprise for a lot of people. So let's take a $6,700 maximum out of pocket. If you divide that up in a monthly basis, that's $550 a month. And I don't even know of a supplement that costs $550 a month. Most of them are less than half of that. So.
And then, Wes, just to wrap up, what would you recommend for your parents if they were 65, 75 plus? What might be helpful in today's insurance environment not to overlook and not to forget about?
So obviously, I would recommend that my parents have a supplement. That's my personal choice, what I would want them to have, actually what they do have. And some home health care. Home health care, convalescent care, short-term care, whatever you want to call it, it's essential that you have that type of coverage. Most people these days are receiving a lot of care inside their home before they have to go to a facility. There's a lot of times they can be taken care of properly at home. And what's important to remember is that Medicare doesn't pay any portion of that. Most people spend a lot of time worrying about the supplement or the Advantage plan. And don't get me wrong, those things are important. But let's not forget what that's covering. People get a supplement or an Advantage plan to cover that 20% they're responsible for. Well, 24/7 care, you're responsible for 100%. That's a crazy liability. And it's very important to have extra protection for that in addition to the supplement or in addition to the Advantage plan to make sure that's covered.
So one of the first things that I wanted to talk about today and just to mention is something that we call pandemic fatigue. I know I've noticed this in myself. I've noticed it in with residents and family members, and we've talked about this, but wanted to give you a little insight about that. And this is something that our CEO, Danny Sanford, has shared with us that I thought was really helpful. So see if you recognize yourself in any of these descriptions of pandemic fatigue and how to combat it. Signs of fatigue. You're not as diligent about wearing a mask or washing your hands. You're not as careful about social distancing as you once were. You're getting enough sleep but still feel exhausted. You're more impatient and irritable. We get upset over things that wouldn't normally bother us. And we're finding it harder to focus and to concentrate. All of these things I think we all have seen in ourselves and others from time to time. It's really hard to be going into so many months of this pandemic and still stay the course, but it's really important, particularly with numbers going up right now, that we do stay the course. So some of the options are connecting with others through phone calls, chats, outdoor visits, things like that. Exercise with our wellness team, Denise and her staff, and walking in the forest, things like that is very helpful. Creating a quarantine bubble. I love that idea, that you can trust. Folks that you feel comfortable socially distancing around and wearing masks around, and not visiting with the others right now. And then making sleep a priority is another option. Go to bed and turn off technology for at least an hour beforehand. Getting good sleep, good exercise, good nutrition are all part of combating the pandemic fatigue. Okay. So also wanted to talk with y'all about today, staying safe over the holidays. I think we're all very blessed that we have an executive team that really looks out for our best interests, not only as residents, but as staff as well, and as we interact together in this wonderful place that we call Still Hopes. So I wanted to just highlight a couple of things from Danny's letter that recently went out at the beginning of November about staying safe during the holidays. Also, I wanted to read to you something that I was researching this morning from the CDC, and this is verbatim what they said. People at risk for severe illness. If you are an older adult or person with certain medical conditions who is at increased risk of severe illness from COVID-19, or live or work with someone at increased risk of severe illness, you should avoid in-person gatherings with people who do not live in your household. That's directly from the CDC, and of course our resident population here are older adults. So Danny's letter is spot on as far as addressing that. So just pointing out a couple of things. Please, please, please stay this course of safety and diligence that we are on. Please fight the pandemic fatigue and let's all stay safe moving forward. Enjoy the Thanksgiving holiday right here at Still Hopes. And I know a lot of you are doing that, and just give you kudos for that. If you must keep Thanksgiving away from Still Hopes, please do maintain the 6 feet of social distancing, wash your hands, wear your mask, be mindful of who you're around. I'm so proud of you all and of our family members who have reached out to me and to other staff members and said, we are so grateful for the diligence you at Still Hopes are taking with our loved ones. We don't want them to get sick either. We want to keep everyone healthy, and we really appreciate partners like that and your attitudes and your family members' attitudes towards safety. Well-ventilated and loosely filled rooms are really important. So keeping the airflow. A lot of times when folks come into my office to have a discussion, unless it's something really private, of course we're both masked, myself and the resident. I scoot back in my tiny office so there's at least 6 feet apart or 6 feet between us. And we also leave the door open for airflow. That's intentional. So airflow, meeting outside, those sorts of things are really important. And then just to maintain our vigilance, to maintain our safety, to maintain our health is of utmost importance. So thank you all for working on that and for helping keep yourselves, our other residents, all safe. All right, and then I've had several residents from time to time, sometimes several a day, ask me about our current protocol and policy with quarantine. And so I just wanted to briefly hit a couple of highlights for that so that we're all on the same page. Residents who have had direct exposure or to someone who has tested positive for COVID, that is a 14-day quarantine with full PPE, full protective equipment for anyone going into that residence. So that has not changed over time. The thing that has changed a little bit are residents who have had a hospital visit or have had an ER visit. So what we ask those residents to do, rather than to have a 7-day quarantine period, is to self-monitor. I think that's really important that all of us are doing that on a daily basis. I know when we as staff come in and have our temperatures taken every day and have our symptoms checked or checked for any symptoms, we are self-monitoring. Do I have a sore throat? Do I have a cough? Anything like that. Sometimes even when we sneeze, we think, oh my goodness, is this COVID? And obviously it's not typically, but those are all good things to monitor. So what I ask residents to do who have had a hospital visit, an ER visit, or are coming home from being with family is to monitor their own health for any changes in health. Obviously, the primary symptoms that we ask about COVID are, do you have a sore throat? Do you have shortness of breath? Do you have a cough? Do you have any gastrointestinal issues going on that are abnormal to you? Sometimes shortness of breath is that resident's current status, and so that's not a new symptom. But any changes in health, like lethargy, weakness, things like that, are something I would love for you to report to me. Obviously, our protocol and policy is that if you know you've been exposed to someone who's tested positive for COVID, or if you think you have, I need to know about that right away so that we can take the proper steps to keep you safe and to keep all of our other residents and staff safe. So thank you for working with us on that. Also wanted to mention today just a couple things about our indoor visitation that has started just this week on Monday. Lots of you have already signed up for that through completing your consent waivers. Family members have done and also are doing that. So really appreciate our Operation Safe Journey team for their work on this. Appreciate Meredith Walker for spearheading this, and Stephanie Parker, and all of our team here that are working so hard on this. We are glad to see these folks we haven't been able to see inside for quite a while. So we welcome everyone, but want everyone to stay safe, obviously. So just a couple highlights about the indoor visitation procedures. Visitation should be pre-planned. So obviously, we don't want our guests going into common areas of Still Hopes. What they will do is to sign in at the front entrance of McDowell at the AccuShield screen, answer the questions there, and they will go directly to that apartment or cottage where they are visiting that resident. So that's what we mean by pre-planned. We can't have someone go into Palmetto Dining Room to look for a resident or things like that. So that's really important. Residents and visitors need to sign the consent waivers, and those waivers have to match. For instance, a resident needs to let us know that they want this particular person to visit before that person is able to visit. So they need to match in that regard. Visitors must be at least 18 years of age or older. Really important point made there for a level of age. Only 2 visitors can visit at a time. This is to keep residents safe, obviously, to keep our whole community safe, but also to allow, if there is a couple that wants to visit our residents, that they are able to do so. So only 2 or no more than 2 visitors at a time. And of course, those 2 visitors would need to be on that consent list from the resident and would need to have already completed consent forms. Only 4 in-building visits per residence per week. So if a resident and a spouse live in the same residence, as many of our folks do, that would mean 4 visits that week for those 2 residents who live together, as well as a single resident could have 4 visits also. And then I'd mentioned this before, but no visitors in common areas. Also, wearing masks are real important to protect you all, to protect our visitors as well. So we will be giving out masks at the McDowell desk when a visitor checks in. These will be the medical grade mask, such as this one here. And we would ask that visitor and our residents to wear, the visitor to wear this mask while they're visiting, and our residents to wear their mask as well. And maintain proper distance as well. Visiting hours are from 7 a.m. to 9 p.m. Don't have to stay that whole time, but you can if you would like to or need to stay a good portion of that time. So that's a point I wanted to make sure as well. So any questions, we are here to help with this. As I said, we really welcome our folks and our visitors back to campus and would love to see the folks you want to see here. Also, just a reminder that visitors will sign in at the AccuShield screen at the front of McDowell, but also will need to come back through and sign out when that visit is over. So wanted to mention a bit about mask etiquette. That's my term I coined, but I love this, and lots of y'all have seen this on my doorway. This is the proper use of a mask. Across nose and across mask, and then ends up under the chin. Under the nose is not really a protection. On the head or under the chin is not really protection. Over the eyes definitely is not much protection. But one thing I did want to mention, and this is one of the medical grade masks I was mentioning. So, I see residents and staff from time to time when we take masks off or do a lot of touching on the outside of the mask. And really want to caution you about that, because when we're touching that, we're picking up on all of the germs that are on the outside of that mask. So if you need to take your mask off, please do it with the ear handles. And then I carry around hand sanitizer with me. So when I take my mask off, if I'm in my office alone, then put my mask back on. I use the hand sanitizer to sanitize my hands to make sure if there were any germs that I picked up, that those are taken care of. So I hope this helps. We want all of us to stay safe and healthy and get beyond this pandemic to a much better place, and just so grateful for all the things you are doing to help keep us all safe and healthy. Thank you so much. Also wanted to just mention, because a couple of residents have asked about this from the time that the letter came out about the indoor visits. We do not currently and are not currently allowing overnight visits, except in the case where that comes through me, and then I confer with our Director of Health Services, Nikki Robertson, about those visits. Cases where that may be necessary and where we have allowed that and are allowing that from time to time, and again, it's very limited. Or for instance, if a resident has had an incident in the apartment causing maybe a health issue, a fracture, something like that, and a family member needed to come in and stay only in that apartment or cottage with that resident for an overnight, just to make sure the resident was stable and getting what they need and had what they need in the apartment. Also instances where a resident may be on hospice services and an overnight visit with a family member may be indicated because that resident's condition is really changing. So things like that, and we do consider all those needs. We want our residents to be supported and well cared for, and family members to have that time with them as it's needed. But those overnight visits are on a case-by-case basis and are very limited to health issues going on with that resident. So thanks for that. Okay, so thank you for joining us today for Healthy Dynamics. Don't forget to look for the chocolate in your cubbies, in your mailboxes, in your mail rooms. We love providing those and love being with you. Please continue to come to me and other staff with any questions that you might have and any needs that you have. We are glad to meet with you and talk about a particular situation that might be going on, if that would be helpful, and sort of problem solve with you. So thanks for staying safe. Thanks for keeping friends and neighbors safe, and have a wonderful Thanksgiving season. Bye-bye.